I know we spoke a lot about, your career so far and some of the things you've learned and picked up and
Yep.
different things about, your career as a psychiatrist and a child psychiatrist particularly. So there's like a set of questions that I do have that I think are more so probably directed to some of my own things I've wondered about the field of psychiatry
Oh
and
yeah, of
haven't actually
course.
had like a
Let's
psychiatrist
do
to
it.
answer them.
Let's do
So if
it.
you're comfortable,
Of
I do have.
course. Yeah.
Um, so the first thing is, and I also hear about this a little bit when it comes to even like other fields, like probably a little
Hmm.
bit more towards something like primary care or cardiovascular health and different stuff like that. But I do also hear this, or I do also think a little bit about this when it comes to the field of psychiatry. So I think one thing that I notice at times, there's probably a good amount of people that often have like a lot of like questions or slash concerns about I guess what exactly the role is when it comes particularly to the aspect of psychiatry, like any other specialty. Do physicians ever tend to overprescribe particular things? I
Hmm.
often hear that sort of thing when it comes to like antidepressants or like specific medications like that.
Hmm.
And I think one of the things I'd probably want to know, at least obviously you'd probably be speaking more to at least your own experience and what you
Hmm.
know about it. Yeah, like how do you navigate prescribing particular treatment for patients, like when you feel like they're at a point at which they may need something like that, and how do you make sure you're able to do that, sort of I guess like a necessary time, and sort of
Hmm.
how do you navigate some of those things?
Oh, that's a great question. I mean, one of the things that actually I would say to the field's credit has come up while I was in training was the concept of deprescribing. And deprescribing came up because, like, in certain settings, a lot of patients would be prescribed either lots of different medications, high doses, or both. And I would say for myself, I start with like what's really going on with the person who's with me and trying to understand like where they're coming from, where they're at, and really getting a sense of like what the underlying issues are. And I would say like that kind of mindset has really been what guides me. And then as far as like when it comes to managing the decisions on what to do and what not to do with the medication piece, I really think about like look at and evaluate the level of functioning, like how this person is functioning now. If the person is like really struggling, that would be a situation where I would be leaning more towards medication, and it would be focused on like whatever my understanding of the underlying issue is. But actually not just my understanding, like our shared understanding,
Mm-hmm.
because I would be sharing that with them, what I think is going on, trying to explain it, break it down, and also encouraging people to do research on their own as well. And then seeing if like, are we seeing eye to eye on this? Okay, this is something we can do about that. And it's like I don't I don't usually go aggressive with it. I try to avoid being aggressive and just kind of like take it one step at a time. And if if they're having a lot of issues, a lot of struggles, then I would say a little bit more aggressive. But if that's not the case, then it's like we can really just uh, see how it goes. And in general, I kind of err towards less than more, and and also like think about it in terms of, because one of the ways I describe like mental health overall is I use analogies that I've heard before, like either everyone has their own toolbox or everyone has a version of Batman's utility belt. And it basically boils down to like for ideal mental health and wellness, we got to make sure there's certain basic things in place, and that the basic things would be things like getting enough sleep, having a nice balanced diet, getting some exercise in, fresh air, sunlight, things like that. Ideally, some positive, meaningful relationships, which folks can't take for granted because that's not always guaranteed. And then beyond that, would be things like practicing mindfulness, yoga, whatever other things folks use to sort of help manage themselves, like music, dancing. You always encourage movement. And then beyond that would be things like therapy, individual, group, family, and medication is also there. And then there's also like the different levels of care you can have with that. But everyone should ideally, like, let's figure out together what what tools work for you, and help you to maintain and manage yourself.
Yeah, no, I think that's a good point, and I think you even bring up like two, I think, really key aspects of that. I think number one thing I probably didn't think about as much in terms of just like actually working with the patient, on like what exactly the plan is and things like that. And so I'm sure having the patient being as informed as possible and being a part of that process and understanding what's going on and weighing out the options of what might be helpful for them, I'm sure it probably also helps kind of keep things in check and stuff like that. And I think the other aspect you mentioned of, which I think is definitely crucial as well, is kind of like that holistic aspect of not just, one angle, but also looking at here all the different things. Like you mentioned, the utility belt of things that could potentially be able to like help that patient. And so I think one thing I think about for sure, and this is also kind of part of another question I wanted to ask you, was really just as you mentioned some of those things, like how do you sort of implement holistic methods into your practice in terms of helping patients, especially even in the scenario of somebody you do kind of end up leaning towards giving medication or trying medication as a part of that process. How do you kind of utilize maybe some of those holistic aspects so that it's not just just aggressive sort of medication thing, but really looking at it in a way where you're kind of seeing like what's going to help the patient and it doesn't end up overwhelming on a particular side?
That's a great question. I would say, well, in the settings that I work, I do often, it's like a collaboration with individual therapists as well, or family therapists. And a lot of times they're able to incorporate that. When that's not possible, it's like, let's we at least talk about the different things that could be done, and like let's encourage that, let's practice it together or something like that. And if they're open to that, or perhaps there's someone in their life they might be able to practice with or engage in that with. So definitely, and if I had my way, I would make it like more widely available for others, because I actually would really like lots of different types of options available for the community if possible, just because it's like, we got these different things that could be done, like, let's see how it works for you, stuff like that.
Yeah, no, I think that's key. I think probably having that host of options be available to somebody is probably key to, I guess, maybe probably avoiding some of those concerns or challenges of, not ending up, I guess, like over prescribing or, ending up leaning towards one particular thing, but kind of having that wide array that is probably going to also help for like tailoring to particular needs of different patients.
And even just knowing about things that are available, I think that's helpful for folks, because it's like a lot of times people don't know what's going on. It's like it ends up, unfortunately, the I guess the most useful information is not widely available and accessible as it could and should be. And so we end up in a world where it's like you come across folks who are learning about different things for the first time, and it's like, it'd be nice if they knew about it beforehand, so as it could have been helpful for them. But we can just do what we can from our positions.